welcome to the stage Lord Victor Adebowale, Chair of the NHS Confederation.
Hello gang, I'm knackered, and this is going to take about 15 minutes or less, emphasis on the or less. I just want to say a couple of things. We've got some pals here. We've got Mike Bell. Hi, how you doing, Mike? We've got Bola. Oh, everybody knows who Bola is. And we also have Rachel Power. It was the Chief Executive of the Patients Association, and we've met before. So I'm not on my own, right? And if I collapse, I've got a doctor and I've got a Chief Executive Hospital. So I just want to say a couple of things. I won't keep you long because you've got to catch trains, and I'm really grateful that you've stayed because you don't have to, and that's really good. I have to, you don't. But I'm really glad that you have stayed, so I don't feel so lonely. I've walked around the conference and I've been around. I like to think there's a bit of a buzz. I'm biased. I think it's been a great conference, but I'm hardly going to sit here and say it was crap, am I? But I hope you think it was a good conference and that you actually got what you needed and you got some energy and some ideas and some confidence to face the future, which is the idea. So I think it's been a great couple of days, actually. But as I say, I would say that. So I'm going to ask these people who are big cheesers and are honest enough to tell me otherwise, if I don't think it is. So I'm going to start with you, Mike. So how's it been? What have you gained, if anything?
I think it's been a really high energy conference,
Thank God for that.
Is fantastic. I was really taken by something that Amanda said on the very first morning. We have been in a time where we've got immense financial pressures on the system, and those of us within the NHS, particularly in ICBs or trusts, will have gone through 4 months of trying to land our operating plans, including a submission on Wednesday morning. We've got performance challenges like never before, and we've got industrial action. But Amanda didn't start off talking about those. She started off by saying, don't be complicit in the narrative of despair. And that to me feels like actually that's our task. After these 2 days in Manchester, we need to go back to wherever we're from and actually not be complicit in that narrative of despair, but look towards the future. And actually, wandering around the exhibition hall, going to sessions, I thought that we had, that energy that I was talking about. There was a real spirit of optimism. If you look at the number of health tech companies that were actually represented, I think it's the greatest number we've had in my 20 years of coming to Confed. And in that context, I would say we're probably 3 to 4 years away from an amazing productivity revolution as we begin to apply that technology to the work that we're doing. But I think in doing that, we need to really remember that it's not just about the tech, it's about the people, it's about our staff. And I saw a huge amount of stands again and conversations which were focused upon how can we support, how can we develop, how can we work with our staff to get the very best from them and support them. And alongside that, fantastic community organisations, probably not with too many stands because they're a bit too expensive, Victor, for some of our community groups.
Sorry about that.
But they have been here, and they have been speaking at every single one of the events I've been at. There's been a voluntary sector rep, and that to me points to this really exciting future. So as we get that productivity gain from health tech, we need to be thinking about how do we engage with our partners in the voluntary sector, and alongside that, how do we work with our patients, our communities that we're serving. And some fantastic organisations out there working with communities which we tend to talk about in the NHS as hard to reach.
Excellent.
Bola's going to say much more about that, but a real high energy conference, real privilege to be here with colleagues and to share that spirit of optimism.
Excellent. Well, Prof, Prof. Bola, Owolabi, what do you think?
I'd like to congratulate you
Me?
and the NHS Confed and colleagues across the NHS for a hugely successful and impactful conference. I've learned a huge amount from this conference. And I just want to maybe reflect on a number of things. I was really struck by the attention to the mindset that we need to take from here. And Lord Victor was saying in his opening remarks, we are too privileged to be pessimistic. And that really stayed with me, and I hope that we will all continue to reflect on the fact that our mindset does matter, and that we appreciate our privilege as we live here. And absolutely, as you were just saying there, refuse the collusion of despair. The second thing that I am taking away is the imperative of leadership, particularly system leadership, that is able to translate what we're trying to say across organizational boundaries, that is able to appreciate the pebbles in other people's shoes, can craft a narrative of a joint and shared purpose and mission that we can all coalesce around, and that we continue to hone our own leadership to make that happen. The other thing that I was really heartened by, and I was sharing it just before we came here, is that there was a whole dedicated theater to health inequalities improvement.
Yes, absolutely.
That's a first.
Yeah.
And thank you, because it really says to me that we are at an inflection point where the NHS constitutional requirement that we differentially focus our energy, efforts, and resources on people that will otherwise be left behind, that we're pivoting from that being a few lines in an old document to our lived reality today. And that fills me with an enormous sense of hope. And what I hope you will all do in leaving here from this conference today is to use the privilege of your voices to continually speak up on behalf of those with little or no voice. Thank you.
Excellent. Very good. Very good. Couldn't have probably better myself. So, Rachel, Patients Association, it's all about you, actually. It's all about your patients. That's why we're here.
Yeah, it's all about the patients.
It is.
And I want to agree totally with everything I've just heard here before. And I want to thank NHS Confed and the team, because it must be such hard work to organise this. And when I come to things like this, I try to think about patients who are struggling to get access, people who are sitting on waiting lists, people, you know, at risk, experiencing inequalities. And I suppose the bits I want to take out of Amanda's speech first on the first morning was that passion around listening to patients and bringing them with us. And the Patient Association is all around patient partnership in the design and delivery of services, and in that individual care, that whole role of shared decision making. And I like to see that. And I also thought that Amanda talked quite strongly about the role of culture and the role of management and leadership, and how important that is. Because as an organisation, who I met here this last couple of days, are people who are really passionate about getting it right for patients. And how do we replicate that across the country, which is really, really important. And when I'm talking about patients as well, I want to reflect on frontline staff and how hard they've worked. So it's lovely for them to be here. The other thing I wanted to just quickly focus on was when Matthew Taylor did his speech, and he talked about services being designed and pathways being designed around patients. And we've heard a lot over the last few days around the holistic approach to care and looking at the whole person, because I think that will impact on inequalities of health as well. And then I want to talk about patient power, and I want to pay respect to Merup, who was at a session earlier on talking about Martha's Rule and the role of where she has taken that to get her and Paul in getting Martha's Rule expanded across NHS England trusts. Now, for me, that's really important because we can, staff and patients, partner together. And then I'm going to rob something from the last session, and somebody said change is hard, and letting up and giving over patient power is hard. But we saw some of that here today, and when we start to give power to patients and work together in real partnership with them, I think that we really will have an NHS that will grow and grow to be a really successful thing in the future.
Excellent. Well, that was fantastic. I'm not going to keep you any longer than I need to. I think the last session actually with Rob Webster and Henry Kipping, Nicola Noble, Steve Russell, Polly Kirk was excellent. I think we might need to move that up next year, actually, because I thought it was about the future, frankly. Very good. So I just want to say thank you to Mike, thank you to Bola, thank you to Rachel for your thoughts and insights. And I thank our sponsors, Google and Novartis, because without you, we wouldn't be able to afford this big building and we wouldn't even have a tent. So thank you very much for your sponsorship. It's very much needed. Can I thank my team at the Confed, because frankly, I just have to be in the right place at the right time, not cock it up. And I've tried not to do that, so I hope that I haven't let you down, but you are all stars. You're all fantastic. You are all stars. And also the team... and the team at NHS England who have also been working with this as a partnership, so we couldn't have done it without you. And if there's any of you in this audience, cheers, you're all cool. Very good, thank you very much. And not least, can I just say thank you to all you people, all you good people. You're all stars, you're all fantastic people, and you know, without you, we have no conference, but we have no NHS, and we certainly have no NHS Confed. So thank you for sticking with us, and thank you for sticking with us. I don't know, are you all leaving energised? Or, and if not energised, knackered, because you've actually, spent your energy, but you're leaving thoughtful and with new ideas and new thoughts and hopefully, new hope. There is always hope for improvement. You go away with my best wishes. Have a great journey home, a chill. You've earned a film on the train. Tomorrow, we start again, we go again. Thank you very much.